When I think about treating my patients with neuroendocrine tumor or NETs, the first thing that I take into account is the individual patient. Not a single patient is similar to another one. So it's important to assess what are the goals of the patient. The age of the patient can take a big role as well, because if the patient is elderly and doesn't have a good function or have a lot of comorbidities, that might guide my treatments a little bit. And the amount of symptoms. So patients that have perhaps a very low growth tumor and no symptoms, I can discuss with the patient if they feel comfortable just watching and repeating scans in 3 to 6 months, depending on the history that I get from the patient. However, patients that have symptoms such as carcinoid syndrome, and symptoms are diarrhea and or flushing, I think these patients will benefit from the gecko with somatostatin analog, because they will control the symptoms, and controlling the symptoms they will feel better. Not to mention that they will have a benefit in tumor control that we know that has been studied, and we saw that the somatostatin analogs have both improvement in tumor control as well as symptom control. Neuroendocrine tumors are up to recently considered a very rare disease. You know, the mascot of the disease is a zebra. So it's very important to have your treatment guided by someone that does that for living and have a large volume of patients, because there is not very strict guidelines in how to treat this disease. Each patient is individual. The speed of progression in one patient is different from the other. Sometimes to make decisions about switching treatments, you have to go back and look at scans from 2 years ago, because that's how long it took for the tumor to grow in a significant way. Therefore, I cannot emphasize how important it is to be seen by someone that has a large practice in neuroendocrine tumors. And if you don't live close to a center that has a neuroendocrine tumor expert, you certainly can you do a dual approach when you have your local oncologist working very closely with an expert in the field. And all of us in the neuroendocrine tumor world are very used to co-managing patients with oncologists in the community. That's actually what we want to, because I think that's the best of both worlds for the patient. They can get their treatment very close to home and have the opinion of someone that does that for living every day.